Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics. Today, I've got two guests with me, Lindsay Thieken and Nilda Gonnella-French, who will talk about the importance of the hospital's patient surveys. Now, Lindsay is a process improvement specialist at the hospital, and she's been there for 25 years. Wow, congratulations. And you're currently in process improvement, where you're championing efforts to improve patient care and the whole experience, gathering data to support the process improvement and the patient satisfaction process. Nilda is the quality and risk manager at Northwestern Medical Center. She's been with us for 23 years. In her current role, she oversees all risk management activities at the hospital. She leads quality improvement efforts and ensures NMC's compliance with regulatory standards. Wow, you two have a lot on your plate. So welcome and thank you for being here.
Thank you.
It's great to talk about the patient surveys, because I think it's confusing to folks sometimes of, I've been at the hospital, so, why am I getting this survey? So could you tell me a little bit about the patient survey and why we do that?
Well, we know it's the right thing to do. So there's a correlation between the patient's perception of their care and their outcomes. Our mission is to provide exceptional care to our community, so it's important that we get their feedback. We know where we're doing well, we know where we can improve. Also, the federal government requires a hospital of this size to participate in the HCAP survey. So that's another portion of the survey process.
So tell me a little bit about HCAPs, because that's probably something that's a little bit foreign to the community for sure.
The federal government wanted to find a way to compare consumer data, gather consumer data, so they built a survey that they could administer throughout the nation. All hospitals of certain size give those surveys to their patients. Mm-hmm. They've gathered that data, and that's allowed them, first of all, they posted the data so that it would be transparent. Consumers could see what the different hospital scores were, and that was their first step. Their second step was to incentivize hospitals to improve their quality by using it as a tool to reimburse based on our scores. So, if we scored well, we would receive our reimbursement for our Medicare and Medicaid services that they were withhold, or we could receive a little bit more. That's the HCAPS part and why it's important. We also have received awards based on our avatar portion. And
that's terrific.
Yeah, those are for 6.
That's to be proud. You can be proud of that.
It was 6 years in consecutive years we received the overall best performer, and that was an award that was a combination of our scores in our emergency department, our surgical services department, our inpatient areas, and our outpatient areas. So it just showed the consistent and well-rounded base of service and culture of service that we have at Northwestern Medical Center.
Well, that's excellent. Well, congratulations.
Congratulations.
So it is really, that is really important to create a great patient experience. And it sounds like now we're even getting paid based off on how well the patient enjoys that patient experience. So I read the surveys, and the results, and there's some really wonderful results, and there's some opportunities to improve. But some of the comments that I'm hearing is that I've taken this survey enough. I come for outpatients. So talk a little bit about survey fatigue and why we have to survey, and is everybody getting surveyed, and why is there so many surveys?
Well, it's really important to respond to these surveys because it's a method of supporting our hospital. And as community members, our hospital is a very important fixture and feature that, for our patients. One of the things that is important is that only patients that are inpatients that are discharged home will get this survey. So any other statuses may not get the survey. That's particular to the actual HCAP survey. If a patient comes in and uses some of our services, such as the emergency department or the laboratory, they will get a patient satisfaction survey if they're randomly selected. So therefore, anybody that gets, as I said, that gets in a bed as an inpatient status will get a survey. So people may get multiple surveys if they're inpatients on multiple occasions.
Okay.
People that come in for using our emergency department, our lab, as I stated earlier, would get random surveys. It's really important to support our hospital. And when you think about how can I support my hospital? Well, you know, there's obviously gift giving and those really sort of big gestures on how to support a hospital. But this is a really basic gesture to show your support for your community hospital. It's also a way to sort of give a rah-rah to the hospital. If you want to cite something that you thought was really special and important, you can add it in the comment section of the survey. We share the comment section with all our managers, and as you stated, you read all the comments, and we take actions and process improvements based on the comments that we hear in our survey.
So is there an improvement activity that, like, do you recall a situation where you got feedback from patients and you made a change based upon the patient's feedback?
Yes. In the comment section, we had a patient, I think he was parking in the handicapped area, and he would walk into the hospital, and there's a slight slope, and then come up and slight slope. So there was actually a puddle forming in the sidewalk right there, and it would freeze. And he told us, could you please fix that portion of the sidewalk? I, hit it every time I come in. And so we just happened to be doing some facilities improvements at the same time, and we fixed that little piece of sidewalk, and I heard from him.
You
he was,
did?
He was very glad that we had fixed that. There was another situation where the survey is private. It may not be anonymous, but it is private. So there's an opportunity for patients to request to be called if they would like to be. And this patient requested a callback, and he explained that he was coming in for some treatments, some procedures, and requested a certain tubing for us to get, so he wouldn't have to be stuck twice each visit with a needle. And we looked into it, and this tubing expires. And we had purchased it before, but we discontinued it because it expired every time, and it was expensive. But when we found out his schedule, he was going to be in often. We were able to buy the tubing, and it just was a win-win for both of us. It wasn't expiring. We were able to give him what he needed, and he was very grateful. Yeah.
That's wonderful. So actually using the feedback. So really a message to the community is your feedback matters. We want to hear what's good so we can keep doing that, but we also want to hear what we could improve on so we can improve that patient experience. So it's a call out for folks to complete those surveys, because the more you get, the more helpful it is, I would assume.
Yes.
So who administers the survey? Is this something that you do yourselves, or how does this work?
Well, we actually have a contract with a vendor. The vendor is named Avatar. We work with them. They get patient lists and addresses that are transferred to them electronically, and they're located in Florida. So when you get the survey, when a patient gets a survey, sometimes they're a little thrown by the addresses because it's not coming directly from Northwestern Medical Center. But what happens is you return the survey, the company Avatar analyzes that survey for us and publishes the information on the website that we can have access to. So Lindsay, myself, all the managers, Jill, anyone can go in from Northwestern Medical Center can go into that website and study their data. The good part is you can cut and slice it different ways depending on what department you want to look at. And the other good thing is the data analysis, right? It's priceless because
I can see you guys love the data.
Yeah, right. But they can slice it and dice it so many different ways, so we can really narrow and kind of drill down on a specific department, and in some situations even specific areas of certain departments. So it's quite a gift, and would be quite an endeavor to try to do that ourselves. So we're really grateful that we have their resources available to us.
So how do you help the managers drill down? And do you have an example of maybe a manager has done a drill down and you've seen them
I'm sure
do
Lindsay does.
some pretty incredible things? You talked about the parking and the tubing, but how a manager, you probably work right alongside the managers and use
yes.
of that data?
Yeah, they help set their goals for the year. One way we can slice and dice the data is by service line. So
okay.
The medical service line, the surgical service line, maternal service line, and they'll look at each service line will look at their data. And one example, we'd seen that our medical service line seemed to be lower. And I looked into researching this and kind of said medical patients tend to score lower. They just give you lower scores. But our director of hospitalists, Dr. Ferris, said, oh no, no. So he took that challenge and he took it back to the medical service, and it really, their scores, that service line scores came up drastically in the last few months. And this is with the HCAP scores and the communication with doctors. So definitely the feedback of the data challenges people to improve.
Right. That's what it's all about, using the data as a process improvement tool. That's what we want. We want the feedback from our community so we can get better and better.
Excellent. That's wonderful. So I can feel your passion about this. So how do you educate the staff? Get that same passion, because you can read the data and you can slice it and dice it, but how do you get that experience so everybody's sort of doing it? So there must be some education that you participate in.
Yes. We have Avatar supports us in education through webinars and different materials. They have conferences that we've been able to attend and then bring back what we've learned. It's very obvious to all of us. We know that it's important to our leadership, and that's important. It's in our strategic goals. So we have developed a patient experience action team, and this is definitely a frontline team. It's where we need to have that patient's perception of care and service and quality show in their registration, in their lab draws, in their diagnostic imaging visit, their visit to their physician offices, right out there on the front line. So this group is made up of champions from each department and some managers and leadership members. We gather and share ideas and opinions. We educate ourselves. We learn about best practices. And then we take that back to our departments and share it back. And it truly is a frontline effort from the ground up. And the action group works that way. I think all three of us attend that committee.
Right.
Yeah, it's been a really positive experience, and I think it's really engaged the employees.
Yes.
If I can add to that too.
You can, of course.
One of the things that we know is the patient experience starts from when they exit their car in the parking lot and work their way down the sidewalk to come in through our door. And it goes all the way through the system. So every single situation that they touch, whether it's someone that greets them in the hallway or it's a nurse doing their whole care for 24 hours, every single part of that is important. And we also know that any aspect of that can turn someone off to the point where they'll give you a bad score in a survey. So what we have to do is have every experience, every time, every encounter be perfect. You know, it's a,
perfect.
It's a formidable task, right? It's a goal, and you know, and certainly that's the goal that we want. And we need to sort of embed that and put it in everyone's DNA, so everybody sort of gets up and feels that way, right?
Yes.
So it's a process. It's a process.
Excellent. Well, we're running out of time, but is there anything that you want to tell our folks who are listening about the importance of this survey? Because I know with your energy, you love getting that feedback. So anything you want to close on?
I guess I would like to say, kind of echoing what Nilda just said about every time and always, the HCAP survey has some responses, and those are This always happens during my hospital visit. This usually happens during my hospital visit. Sometimes happens or never happens. And when they're scoring it, we only get credit if the patient says, this always happens during my hospital visit. So whether it usually happens or never happens, it doesn't matter. It needs to always happen, and that's what we get scored on. So it's important, yeah.
Wow. Excellent.
And what I'd like to say is if you're going to fill out any survey, fill out this survey.
Oh, yes, because we all get so many surveys. So, yes, the most important survey for you to fill out is that one for Northwestern Medical Center as a patient, because it is so important to our future, and so are you, all of our community from Franklin and Grand Isle counties. So thank you so much. This was fun to talk about. So Nilda and Lindsay, thank you. And this is Jill Berry Bowen, your CEO of Northwestern Medical Center. Thank you so much for joining us for the topics on patient surveys.